This is Channel 253.
Move to Tacoma. On this episode of Move to Tacoma.
And the thing about it, you know, the kids go to sleep, so they don't know what's going on. They wake up, everything's done, and they still like coming to the dentist. They still like us, you know? So the next time I see them, they run up to me, they're happy, they hug me, they show off their princess crowns. So it's been pretty awesome.
Channel 253 is member supported. I'm producer Doug Mackey, and I hope you will show your support by going to channel253.com/membership and join. Thank you. We're back.
I'm Marguerite, and I want you to move to Tacoma.
Move to Tacoma, move to Tacoma, move to Tacoma.
You'll like it.
Move to Tacoma, move to Tacoma, move to Tacoma.com.
Hi, I'm Marguerite with MoveToTacoma.com, and I'm here today with Carolyn McDougall Weyrick. Welcome, Carolyn.
Thank you, Marguerite.
And Dr. Alicia Stephens.
Thank you, yes.
From Lindquist Dental for Children. Thanks for coming.
Lindquist Dental Clinic for Children.
Lindquist Dental Clinic for Children. We're not letting any mistakes fly today.
Just because it's children.
Children. For children. Right. So first, before we get started on the fact that you all provide dental care for children regardless of income, you don't turn kids away regardless of their situation, and you've been doing this for basically 100 years in Tacoma, right?
Well, a very long time.
A very long time. Before we get into all that, I'd love to know for each of you, when did you move to Tacoma and why? Who would like to go first?
Well, I will start.
Yes.
Never moved to Tacoma because I was born and raised in Tacoma, proud Tacoman, and born on the east side of Tacoma. And my parents actually came here via the military. So back in the 60s, my dad was enlisted at Fort Lewis. And my parents are both from Georgia and moved up here, loved Tacoma, and this is where we all stayed. I'm here, my brothers are here, my mom is still here, so Tacoma is home. But I grew up on the east side, went to Foss High School, Stewart Junior High School, Sheridan Elementary. And then once I graduated, I did leave the state for a little while, went to California, went to Stanford, came back, wasn't sure what I wanted to do, wasn't sure if medical was the right way, dental was the right. I had no clue what I wanted to do when I graduated from college. But I had a couple friends that had gone to were in dental school. And I was like, well, let me just check that out. And I kind of just fell into dentistry, really. It's not something that I grew up.
I feel like everybody I know who's a dentist had a parent who was a dentist. It feels like that.
It feels like that way. And when I was in dental school, too, all of my classmates had moms, dads, cousins, brothers who were dentists. And then here's me. But it didn't happen that way for me, you know? And even when I first started dental school, I wasn't sure, did I pick the right avenue? Is this the right career for me? And the first 2 years were tough. I went to University of Washington. But by that third year, when we started working on patients and interacting, I'm like, okay, I think I can see myself doing that. And then I did a rotation through pediatric dentistry. And then I just fell in love with it. I'm like, okay, the kids are for me. This is what I want to do. So, yeah, that's how I kind of fell into dentistry. And now I've been at it for 24 years and just absolutely love it. 16 of those years I've been at Lindquist.
I love it.
Yeah. So I live in Puyallup right now.
Okay.
So
are you
South
down?
Hill.
Okay, I was just gonna say downtown or South Hill.
South Hill, Puyallup, but still in the area. So I love this. I love Tacoma. I love Washington. This is home.
What do you like about living on South Hill? What are your favorite things?
Oh. Well, I used to like before. I mean, it's expanded so much now. There's so much traffic coming down Meridian, so do not like that. But it's just a beautiful place. It's calm. The neighbors are great. We have this beautiful view of Mount Rainier when we're coming down 160th. So every time I'm driving home from work, I just come right. Work is 13 minutes away, which is beautiful.
Amazing.
But I come right down 160th, and in the spring and the summer, I get this magnificent view of Mount Rainier, and it just brings me peace. It makes me smile. So, and just the people, the folks up here, just they're kind, they're warm. It's a different vibe. I love it.
A little more relaxed.
Much more relaxed. Much more relaxed. Absolutely.
I made the opposite journey. I grew up on South Hill, and now I live in Tacoma.
Oh, okay.
Yeah, partially on South Hill. I kind of got around.
Well, it's not like downtown Tacoma is like crazy, out of control.
That's not my experience, although Facebook comments might tell you otherwise. All right, Carolyn, when did you move to Tacoma and why?
Well, we've worked together for 16 years, and I didn't realize your parents were born in Georgia because I was born in Georgia.
What?
So I wasn't born in Tacoma, but long history, but I ended up in Tacoma, I think it was about 1992. And I worked at Marybridge Children's Hospital for 10 years, had a little brief stint out of the area for a couple months, but I came back because I loved it. And I've been with Lindquist Dental Clinic for Children for 24 years now, or 24 years in December, so a little shy of that. And so I moved to Tacoma. Actually, when I first moved to Tacoma, I was right next to Stadium High School and in an apartment, and I could walk right to Marybridge Children's Hospital, and that was really great. And then I bought a house, and I ended up moving. And then they tore down my apartment.
Oh, no.
And they built, that's where the pool is now for Stadium High School.
Right.
So when I was living in the apartment, I could kind of look, I was on a corner side, and I could look over and watch the football games at night and stuff like that on Fridays and stuff. That was fun.
That's cool.
But I now live directly above Ruston Way. So if you know any of the restaurants down there, if you come out of Katie Downs or not the lobster shop, Duke's.
Yes.
And you look right up the hill, and that's where I'm at. So I have a 180-degree view of the water. So I do.
Her view's pretty
I
nice.
do love it. And you've been here.
I've been able to see it. It's been pretty nice.
Yeah. So I do love the view, and the pool's fun too in the summertime.
So what is your favorite part about that neighborhood? I mean, I would kind of describe it as like, it's not quite Proctor. It's like between Proctor and Ruston.
Right.
Like, what's so great? Obviously, besides the view, what else do you love about it?
Well, actually, I walk up to Proctor all the time. I mean, it's really a quick little walk. There's a Peter Puget Park. I just go to the bottom of my hill, and then there's this beautiful walking trail that I like to take my dog, and we walk up to that other little park that's at the top of Proctor. I can't remember the name of that. And then, you have all the little shops and coffee and restaurants and little shops. So we do that a lot on the weekends. And then also I just walk, right down and walk up and back on Ruston Way, and so you have Point Ruston at the end, where my mom actually happens to be in assisted living at GenCare, and so I can get in the car and drive to her and be there in 3 minutes. So that's nice, and there's all kinds of little. There's movie theater and restaurants and shops down at Point Ruston. That's fun. And then I just turn the other way, and I can be right downtown, where we are right now.
Absolutely.
And so jump onto the freeway, and it really only takes me about 20 minutes from my house to the clinic.
And the clinic is located
in Parkland, Washington.
And
so
has
it's
the
very
clinic
movable.
Has it always been in Parkland?
Not really. I mean, always. We go back to 1936 when we, were first started.
So 90 years. I exaggerated.
I know.
It's been 90 years.
Dr. Stephens and I haven't been there that long.
Just to clarify.
Anyway, but it's been there for a while. I've been there for 24 years, and we were down the street from PLU, Pacific Lutheran University, when I first started in a teeny little spot. And literally the doctors took notes, and they ate lunch, and they did reviews of charts in this little closet, almost like a little broom closet. Wow. And it was only a couple chairs. And when I first got there, and then we expanded and shortly thereafter and went down the street. So we're not far from that one spot that I was referring to. And we have been, I guess it's been about maybe 21 years that we've been down in Parkland off of 131st Street.
131st and Pacific, basically, right? So from Tacoma, like you say, 20 minutes.
Right. From my house down on Ruston Way, about 20 minutes. So maybe
from
15,
downtown.
16.
And you said about 15 minutes from South Hill.
Yeah.
So this is a really good location for the whole county,
Absolutely.
basically, right?
Yeah. And we serve, we serve children from all over the Puget Sound area.
So you're saying you don't have to be a Tacoman to get your child free?
No,
dental
but
care.
we love Tacoma, but no, you don't have to be a Tacoman.
Anybody in Washington State or anybody in the country?
Anyone in Washington State can come, pretty much. We've had kids that have been visiting grandparents or something from out of state too, and they've also,
You don't turn people away.
We don't turn them away.
Oh my gosh.
Now, if they're crazy and acting up and throwing things.
Just kidding. These are kids. Not even then.
That's the parents, right? No, but basically due to inability to pay. So we see every child. And when I say children, I do want to preface that it's from birth to their 21st birthday.
This is why I really wanted to have you on the podcast. So Carolyn and I know each other because we were both in the leadership cult together, as I jokingly call it, the American Leadership Forum. And we were in that program 10 years ago, and we were having dinner recently, catching up, and I was like, I don't totally understand what you do. Like, I knew that you had a nonprofit that helped kids get dental care, and so that's where I wish I was more curious. I wish I just kind of zoned out because I knew I couldn't go there. But then you started talking about it, and I was like, wait, because first of all, like you say, it goes to 21 years old, which means kids that are having their wisdom teeth out
absolutely
can get care from you. And you said, and then I was like, oh, well, it must be only for like very poor children. And then you were like, no, we do everybody, any child. And I was like, wait. So if people come with insurance, and you were like, yes, we take insurance. And in fact, like, we want people with insurance to come because that helps like subsidize the kids that come for free. So I know I'm saying a lot at once, but we have a lot to cover in this conversation because one of the things that kept happening when we tried to I was like, oh, I'll just make a video about it. I'll just make a little sound bite. And you're like, well, there's some nuance there. So we're just going to have a long, deep conversation about insurance and care. And what about this scenario? And what about, is that okay?
Yeah,
just like, let's talk about all the different ways that kids in Pierce County and Washington and everywhere in the country apparently can access care in Parkland from Dr. Stephens and your whole crew. Because it's not just you, Dr. Stephens.
Not just me. There's 6 of us, actually.
6 docs.
6 docs. 4 full-time, and we have 7 now because we have, this is why we have to have a
changes moment by moment.
Actually, because we have some specialty services that we've offered, that we're offering now, and you mentioned the wisdom teeth.
When I took the tour, I was like, there's a surgery room.
Yep.
There were tons of dental techs.
There
were
things that we're doing.
This was like the biggest dental office I'd ever seen.
It's huge.
Yeah.
We have 15 chairs, and it's really about expanding our access to care so that all of these kids have access to quality care. So what we were finding, especially with wisdom teeth extractions and kids that need root canals, there's only one oral surgeon office in Tacoma that takes state insurance. And the wait times for these kids to get their extractions could be anywhere from 6 months to a year.
If it's okay, Dr. Stephens, I want to ask a lot of kind of dumb questions as you go.
Absolutely.
So state insurance.
Yes.
How would someone know if they have to? What are those called? Is that Apple?
Medicaid. Apple Health. Molina.
It could be anything.
It could be anything.
Yeah. So
absolutely.
Is there any insurance that you don't take? Let's just start there.
We are credentialed with just about all of the major carriers.
So just if you're listening and you're listening for yours, they call the front desk because they'll tell you.
Exactly. And most likely they'll say yes.
Okay,
So,
great. I just sorry to interrupt. I just want to make sure.
Worries.
Sometimes we say things like that and people, I don't know what they mean.
Yeah, Medicaid.
Yeah.
And so when she's saying state insurance, Medicaid, Washington Apple Health, coordinated care, any of those types of things that are funded through the states, and then all the other private insurances as well. And one nuance that makes us a lot different, and we'll talk about that, I'm sure, about, is we also take TRICARE Dental, but for the families that income qualify, what's different is that then they do not have to pay their out-of-pocket or deductible with TRICARE Dental, and so we're the only ones that are able to do that. And to income qualify, for example, it could be a single active duty person with one child.
Right, so just to clarify, TRICARE is the military's healthcare system, right?
Right, and so since we're located right by Joint Base Lewis McChord, and we serve a lot of military kids, this is an opportunity for them to be seen without all of those other costs that would be, normally associated with it if they income qualify. And to income qualify, even if it's just a single person with one child, they have to make under $77,000. So most of the enlisted folks qualify to have that no out-of-pocket cost. So that's a little bit of a nuance that makes us different, but we take all of those insurances.
Well, and I think there's so many layers to why this is awesome, because it's like, okay, so we're a military family, we have a couple kids, we income qualify, we can take our kids to multiple places. But if they take their kids to Lindquist, they're not going to have to pay any additional, because that's what happens, right? You go to the dentist and you have insurance, but like the thing I always find with dental, I mean, please correct me if I'm just wrong, but like, I mean, insurance, and you go in and it's like it's always more than what the insurance covers, right? You're going to pay a few $100 for whatever you're having done. And my teeth are not perfect. Like, there's always something that happens besides my cleaning. They're like, we got to go in and do this, or we've got to go fix that. And like, it's always out of pocket cost. But for what you're saying is probably, I mean, like, we can't guarantee, talk to the front desk lady.
But
I mean,
most everybody that is an enlisted service member or their family, their spouse or whatever, can bring the children up to 21 years of age.
Up to so if the spouse is under 21, they are also
they would also qualify.
Okay.
Yeah. So and if they have TRICARE Dental income qualified, then they don't pay that copay or out of pocket cost. So
I think this is huge for the
huge.
military.
And
like we just need to get the word out, because this is a big deal.
Yeah. We have so many military families that come in and are so grateful that they found us, because they've gone from office to office and having to, if they got 4 or 5 kids, having to pay these co-pays out of pocket for all of the kids. It's a big deal. And sometimes these kids, their cap is $1,300 a year. So sometimes these kids have a lot of work to do, which can be more expensive than that. Yeah. So then, they're on the hook for that additional cost. So we love serving our military families. We are here for them. And so many that have found us are very grateful for the services. So it's been wonderful.
Okay, so I think you just opened the door to another question, although I'm going to keep coming back to insurance. I'm going to ask insurance 20 different ways. Okay, so I think a thought that I certainly have as an individual, and I don't know if parents have this on behalf of their children, but like, when you need so much, when it's like, I don't even want anyone to see. Like, I had a point in my 20s where I didn't go to the dentist for like 5 years, and I was so embarrassed. And I think these kids probably until things get painful, right? Like, they don't, and the parents are probably thinking like, they're not going to sit still. Like, how are we going to do this? So you're specialists, right?
Well,
like,
we're not specialists. I just want to make it clear.
Oh, we do have specialists.
We do have
you
specialists.
specialize in children, meaning
we see children from 0 to 21. Yeah. So, but we're general dentists. However, we do offer some specialty services. Our oral surgery service, that's an oral surgeon. Our endodontics service, that's an endodontist. And what we've started offering about 3-4 years ago now, is general anesthesia for our pediatric kids. And that's what you're talking about, the whole mouth. So we have a lot of kids that come through between 3, 8, actually 2 to 8, very, very young, that almost every tooth in their mouth needs to be fixed.
Okay.
And a lot of times with the little ones, it's impossible to get them to stay still, to sit in the chair.
I mean, even with the big ones, right?
It's difficult. I mean, that's a lot of work.
To have you stay still.
So you're talking about, wanting the child to stay still and get all this work done, having the parents have to take off of the work, having the kids have to take out of school, to just a lot of back and forth. So what we started offering about 4 years ago, and I'm the dentist who does it at the office, is what we call general anesthesia. We bring in a medical doctor, and right now that is Dr. Steve Mattson, anesthesiologist, 20 years experience. He's just wonderful. He comes in and he administers the general anesthesia, and then I see the kids and I basically fix the whole mouth in one appointment.
Wow.
Usually takes about an hour and a half.
What?
Hour and a half. Parents are so grateful. The kids, and the thing about it, the kids go to sleep, so they don't know what's going on. They wake up, everything's done, and they still like coming to the dentist. They still like us, So the next time I see them, they run up to me, they're happy, they hug me, they show off their princess crowns. So it's been pretty awesome.
And if that wasn't there, I mean, that might have taken, 6 appointments or more for the parents taking off work, or
6
and would be
whatever.
incredibly expensive.
And the kids is like, no, I don't want to do it again.
Oh, it's so tough.
It
can be so tough. So this has been a wonderful adjunct to our clinical services, and we're open for kids, for GA. Between the ages of 3 and 8, they come in. We'll take a look, and anyone can refer to us. But, there's a lot of kids out there, when what you were saying about pain, what we're finding, a lot of parents aren't really bringing their kids a lot of times into the dentist.
Because they're worried about it.
Until they're worried about it, until the kid is complaining about pain. And sometimes it's not even the children that are complaining or the parents that are seeing it. It's the school nurses. It's the teachers.
Yeah.
So we get referral. We're in the schools as well. So we get a lot of our kids from the schools who the teachers are saying, we need to take a look at that. Or our hygienist is seeing in the schools. So it's, these kids are in need. These kids are in need. They miss a lot of school days because of this. They, infection, pain. And so the great thing, too, about our services is that a lot of times if you're referring to a pediatric dentist for these services, not only do you have to pay the out-of-pocket, and, it's extremely expensive, especially for our TRICARE kids, but there's also an incredible wait time, too.
Yes.
There are pediatric dentists that will see our kids on, Apple Health and what have you, but it can be 3 to 4 months.
That's
and a lot of
such a
times
long
we
time.
don't have that
If a
kind
kid's
of
in pain.
time.
For the general anesthesia, 6 months or more for
this is
oral
for the pediatric
surgery
services. So
or,
the wait time is not quite as long because there are a few more providers that are seeing these kids, but there's still not enough. And that can be an extremely long time for a child who has infection, who's in pain. We want to get these kids taken care of as soon as possible. So that's where we kind of fill in the gap. And these services are wonderful for these kids.
That's great. I'm getting the word from Doug, so we're going to go to break, and then we'll be right back for that.
Great.
This is Eric Hanberg, host of the Channel 253 podcast, Citizen Tacoma.
And this is producer Doug.
When my wife and I needed to sell our condo in downtown Tacoma, we wanted an expert in that niche market.
And I needed an expert in selling a home as part of an estate sale.
We both turned to Marguerite Martin from MoveToTacoma.com. She's a real estate matchmaker. She finds you the perfect agent for whatever your situation.
Not every agent knows what to do in every situation. You want an agent that knows your situation.
Best of all, your agent pays Marguerite a finder's fee out of their commission. So using a real estate matchmaker to help you find the best agent won't cost you a thing.
Visit MoveToTacoma.com, connect with Marguerite, and find the agent that's right for you.
Thank you, Marguerite Martin, and Move to Tacoma for your longtime support of Channel 253.
Move to Tacoma!
And we are back with Dr. Stephens and Carolyn. Thank you for coming on the podcast.
Thank you.
I am very curious. We've been talking about so much even during the break, but I want to start with the schools. Dr. Stephens, you mentioned that you're in the schools. Like, what does that mean, and how does that work? How do the schools plug kids in with the free dental care?
Yeah. Well, we actually are in 5 different school districts. And 60 about 60 schools, and we provide.
It's so embarrassing that I did not know about this, Carolyn.
And we provide screenings, fluoride varnish, and sealants for children in the schools. And sometimes we're doing whole.
So you're doing this in the schools itself?
In the schools itself.
You're doing this like a fluoride sealing type
fluoride
situation?
varnish and sealants, and that's with parents' permission if they want that.
And that protects the kids' teeth from like cavities.
Right.
Okay.
Fluoride is wonderful.
Yeah.
For the record, Dr. Stephens is for it.
Yes. So we are for it, but she can speak to it better than I can. But yeah, so we're really excited because we get to go where the children are, and thus be able to see them. And we have a professional team that goes in there, and they're great, and they can identify if there's immediate needs. We kind of have a rating system of what their needs are, and then work with the school nurse or school professional that's there that can follow up with the parents, and we can provide them, if they don't have a dental home, we can provide them a dental home. And you were speaking to the fact that sometimes parents are a little embarrassed, or oh gosh,
yeah,
it's really
I know I probably should have brought them in.
Yeah. And she doesn't really brush every day, or this or that, or I see brown spots, but I don't know. I got to pay the mortgage or the rent or the or food on the table, and I just let's just wait, honey. That kind of a thing. And our team is so great. Are not judgmental. We just want to be able to see them, and
I don't think that can be stated enough times. Come as you are, right?
Absolutely. One of the things that we really strive for at Lindquist is to not make parents feel judged, because there's so many circumstances surrounding why you haven't brought your child. You know, it could be financial.
Yeah.
It could be fears, dental fears. A lot of times parents have dental fears stemming from childhood. And it stays with them, and they pass those on to their children. So we don't want to be judged. We're just happy that they brought them, and then it's a fresh beginning from there, you know. And then it's about education. We want to teach them what the tools that they need, what they need to do in terms of having the fresh start and having great oral health from here on for the child. So it's really a teaching thing. It's an education thing, and it's very, very non-judgmental. Sorry,
It was gentle.
We are gentle as well.
It's gentle.
Gentle but non-judgmental.
Non-judgmental. So yeah, that's very important.
Yeah, and so, you know, the through the schools, you know, they might find out about us. That's one of the things that I think I shared with you when we were chatting a little while ago is, you know, we see over 24,000 patient visits a year.
This boggles my mind.
And yet we're the little fish in the big pond in Pierce County. And so having this opportunity, thank you, to share what we do, because we want to be a resource to families.
Like, you have the capacity to help
we
our
have
kids.
the capacity to grow. We have and we, you know, as you said, you know, we're serving kids with state insurance. We're serving kids. We also have an uncompensated care fund that we didn't speak to, but we provide about $500,000 a year in just uncompensated care, things that aren't covered for whatever reason. And then we, you know, of course, have insurance ability. And then, you know, we talked about TRICARE being able to waive that out-of-pocket cost. But if they income qualify and have another type of insurance for some reason,
Delta Dental,
we
Lifewise.
can also do that. And we also have sliding scale fees and things like that. So we work with families. So don't be afraid, you know, to bring your kiddos in up to 21, or yourself. If you are over 18, you can sign for yourself, or 18 and older. And we, you know, non-judgmental, gentle, but
gentle and non-judgmental.
One thing that really struck me in our conversation, and I think it's okay for us to talk about this in public. You just tell me, like,
just between us.
Yeah, just between us and whoever's watching on the internet. So there have been some governmental changes in the last year or so, people might have noticed, that have impacted what services are available, like for public services in general, I think in every sector, right? And that's impacted you. And the part of our conversation that I thought was the most interesting, and I hope I'm characterizing this in the correct way, so please correct me if I'm not, was basically like, okay, so we do actually have a bit less money coming in to help these kids that don't have any money, that might be on state services or whatever, because there's just fewer state services, federal services, whatever. There's just less money in the kitty for that. But when parents with regular old insurance or parents with TRICARE come in, they're actually helping those kids. You're replenishing that fund. And you have all this capacity. I'm like, okay, wait, so we just need to tell everybody, like, whether you're income qualified, whether you're not income qualified, whether you have insurance, whether you don't have insurance, just come, and it's all going to come out in the wash.
You did a great
awesome.
job. That was great job.
I just wanted to make sure, like, I understood, because this is kind of what I'm saying.
It is.
Yeah.
And for those people that don't
Sorry,
know,
Doug's telling us to stop yelling.
we're just so excited.
We're very excited.
You know, for those that don't know, Medicaid cuts in Washington State went into effect July 1 of this last year, which we were not anticipating when we did the budget. And then there was an additional cut that just happened. So we're looking at about a $280,000 cut to our what we would normally expect to be getting in with Medicaid. So we are pivoting, and we are still seeing all those same people that we've been seeing with state
no
insurance.
impact on care for those folks.
No, and uncompensated care, but we're also growing our private insurance, like you said, that helps offset so that we can do that. So as Dr. Stephens talked about, we have a 15-chair clinic, including one surgical suite. And when we say chair, that's kind of the whole operatory.
Yeah.
And we are utilizing maybe 9 of them at every day. So we have the capacity to grow. Okay. So we are not turning any of these other folks away that don't have insurances or have state insurances, but we're also looking to grow. And the opportune time has happened. We've always had phenomenal care. I mean, our team is, Stanford, UW grad, I mean, we have,
all the fancy places.
These are dentists that get paid, and they're very great highly skilled experience, and we have specialty, as we've talked about. But we also lost my train of thought. Help me out.
We also, so we have our core dentist, and we have 4 full-time that are, again, some of the best schools in the country.
Right.
And we do a good job. What I love that I think sets us apart a little bit is that we really give quality care. We care about these patients. We care about these parents. We care about these kids.
Yeah.
And so when we see these families, it's about educating the parent. It's about making them feel welcome, connecting with them, connecting with the child, and really helping them understand this oral health journey. And so that's what I feel like we do a little bit different, and we give quality care. I mean, our work is stellar.
That was what I want to jump off of that because you helped remind me. I was like, I need another cup of coffee. But not only have we always had quality care and the utmost, fabulous team, is we have just finished a renovation.
So
and that's why I wanted to say.
When I came in, I was like, okay, free dental office. I mean, already going to the dentist, like you kind of never know what you're going to get, right?
Absolutely.
But it was like super nice. You've just had like a total renovation. This is all new stuff everywhere.
All brand new dental chairs and what we call delivery systems. We have a whole brand new facelift to the whole facility. We got new roof, new windows, new carpeting, HVAC, everything. We've had about $1 million renovation, all thanks to funding we had raised over the last several years.
From like private donors or?
Private donors for chairs, for a community development block grant money from Pierce County for other facility improvements. So this has been something that's been in the making for several years. And it was all money that designated specifically for facilities or equipment. Wow. And so now, and seeing as we didn't know about the cut, and we were actually in the throes of doing this renovation when all of the Medicaid cuts and things came about, it's like, well, we're pivoting, but we have a beautiful facility.
You're ready.
State of the art.
Yeah,
that anyone with insurance isn't going to go, oh, yeah, I don't want to go to that clinic. It's a low income.
Yeah.
No, it's beautiful. And, you've been there, right?
Yes.
So, so we have state of the art care. We have state of the art facility, equipment. We even have nomads, which are x-rays that are digital nomads. So the less, we don't have to go and say, keep coming back and trying to see what less exposure to x-rays and everything. So it's really great. So this is, although we didn't want the cuts, we're poised to now pivot and say, come one and come all, and
So, okay, I have like 2-step question here. So the first is just speed round. What are all the things you offer? Standard.
I'll let her speed round that.
Yeah, so we offer everything. Restoration, so fillings. I guess it's extractions, space maintainers, root canals, oral surgery, wisdom teeth extractions, general anesthesia for kids that have a lot to do, so ages 3 to 8, general anesthesia. We offer actually the general anesthesia is also for our oral surgery kids. Okay. So the kids that are having their third molars extracted, their wisdom teeth extracted, they also receive general anesthesia because many times you don't want to be awake for that. So that happens as well. Just routine care, cleanings, x-rays, education, fluoride. A little bit of everything that most standard offices offer. Yeah.
All right. So maybe there's somebody listening and they're like, okay, I'm not sure. I got a couple of kids, but I'm not sure if we're going to meet the income qualification. And what if they don't take my company or my partner's insurance? Like if we always have weird insurance, like what would you say? Like what do they do? Do they pick up the phone and call? Do they click a link somewhere? How can people find out what their situation's going to be?
Well, most likely they will qualify if there's even a question about that.
Carolyn keeps repeating this. I'm just in disbelief.
But calling our number, 253-539-7445, you'll get someone at the front desk that will be glad to help you. We have a website, lindquistdental.org. There's lots of information up there as well. But I mean, if there's even a question, just call us. We want to see you. We want to work with you. We don't want to make it. We want to remove barriers to access to care, and we want to make it so that children are able to, have the care that they deserve and they need. And I have friends that when, their kids were young, they knew about Lindquist too, and they've used, our services, and they were like, I didn't know if I was going to qualify or not. I was in between jobs, or, I was a server at a restaurant and I didn't have there's so many ways that we can help. And so just to pick up the phone or get online and take a look. But talking to somebody always is, for me anyway, I really like to say, this is my unique situation. And you'll find that it's maybe not that so unique and that we're going to be able to help.
I love it. And it's just such a rare thing where you can pick up the phone and call and ask a specific question like that. So
our front desk and our accounting department is really good about guiding parents as to what they need to do. We've had a lot of families come in that didn't have insurance, and they've given them the links or helped them sign up to get the insurance. So literally, and it doesn't take very long to qualify, to submit the paperwork, and generally within 2 to 3 days, they have the insurance. So
for state
we are
insurances.
really, really great about helping guide these families. So just give us a call. We can help. Yeah.
Amazing. Well, is there anything I haven't asked about that you want to make sure that people know about Lindquist Dental?
Well, I would just add one other thing. I spoke to that we were at schools, but we also do a lot of events in town. So since we want to promote how wonderful Tacoma is,
Yes,
right?
always.
We love Tacoma. we do a lot of health fairs or just, different summer festivals and things like that will be out there. And, you might see Dr. Stephens there sometimes. So we might be doing screenings. We might be out there just, sharing information. And so we really believe that going to where people are and making that connection is, a way to also, say, hey, and if you need a dental home, we're here, So, and thank you for opportunity like this. And, anyone that's watching to please share, with any of your family, friends, colleagues, or whatever. We'd love to be able to help.
Dr. Stephens, any final word?
Well, just that Lindquist is such a wonderful place, and we've been around for so long. We just want to continue that wonderful care that we give to these kids. And again, the motto of no child turned away is just, to me, so important. I mean, we've got kids that come in, and whatever it takes, we're going to do it, or we're going to figure out how to make it happen for them. So I just want folks to know that Lindquist is a wonderful dental home for your children, whether it's private insurance, whether it's Medicaid, state insurance, Apple, whatever you have. It's just a wonderful home. And so look us up. We're here. We've got incredible providers, incredible leadership.
Check out our Google reviews. If you're watching this online, you're a techie, right?
Google reviews, 4.5, which is really good for our type of office. So we're really proud of the work we do. We're proud of who we are and what we stand for. And at the end of the day, when I finish working on these kids, I go home thankful and gratified, and just knowing
and tired.
Very tired, but knowing that we're doing something to make a difference in these kids' lives. So it's wonderful.
Well, thank you both for what you do.
Thank you.
It's really incredible, and I hope lots of people I hope this gets to the people that it needs to get to.
Yeah.
Thank you.
Great. Feel free to
so
share.
much.
Thank you.
Thanks.
If you like this podcast, check out movetotacoma.com. MoveToTacoma.com is a neighborhood guide, blog, and podcast to help people in Tacoma, Pierce County, and beyond find their place in the city of destiny. More information at MoveToTacoma.com. Move to Tacoma is part of the Channel 253 podcast network. Check out these other shows: Grit and Grain, Nerd Farmer, Interchangeable White Ladies, What Say You, Citizen Tacoma, and Kitchen 253.
This is Channel 253.